Welcome back to the show. I'm Julia Hartley-Brewer. You're with TalkTV. Now, Matt Hancock is right now giving evidence at the COVID inquiry this morning. The former Health Secretary has faced relentless criticism from former Number 10 officials and former ministers and scientists throughout the proceedings so far. We're hoping to talk to Professor Carol Sikora, someone who's speaking out against a lot of what's going on in lockdown throughout that whole period, coming up very, very soon. First, let's talk to Russell Quirk, who's still with me. And you were someone, again, who's talking an awful lot of sense on this issue over the time. Now, it is absolutely fascinating. We've seen this array of these politicians and scientists and others appearing, giving evidence. Matt Hancock, it must be said, he's up today and tomorrow. He has got what Politico this morning called must answer the murder on the Orient Express style procession of senior figures who've done him in. Of course, Dominic Cummings calling him a proven liar, apparently telling Boris Johnson, his then boss, the Prime Minister, to sack him. Helen McNamara, a very senior civil servant, saying he'd say things in meetings that she said that we discover weren't in fact the case. Patrick Vallance, the former chief scientific advisor, saying he had a habit of saying things without evidence to back them up. Simon Case, former head of the NHS, talking about him being part of the government's weak team. We had the Mayor of Manchester, Andy Burnham, last week saying that he knew that Tier 3 restrictions imposed on Manchester wouldn't work when he imposed them. Simon Stevens also... Simon Case, was the Cabinet Secretary. Simon Stevens, the head of the NHS, said he wanted to decide who should live and who should die. I mean, pretty damning stuff. But none of that is actually the important stuff because it's about the actual decision-making process. We've seen Matt Hancock's WhatsApps during this whole period, apart from the month of March 2020, when we went from following pandemic planning, as Sweden went on to carry on to do, to throwing it all up in the air and copying what China had done and locking us down on a sixpence. Do you think we're going to find out anything useful?
No, not really. I mean, because look, if Matt Hancock, as you've just outlined, has a tendency to fluff the truth, let's say, according to multiple sources, and this kind of on-off COVID thing as it's kind of played out over the last 3 years, I suspect he's going to do everything he can over the next 2 days to cover himself. I mean, he's not going to do anything other than try to deflect blame, which is effectively what the whole COVID inquiry is all about.
Yeah.
Everybody that has given evidence has tried to deflect blame from themselves, largely towards Boris Johnson, of course, and also to Matt Hancock. That said, I mean, if ever there was a case of a politician that was over-promoted, it's Matt Hancock.
So, they said he was full of like completely, unjustified self-confidence.
Well, yes, that's a wonderful way of putting it.
But that's an awful lot of them. Politicians.
I suspect, in the next 2 or 3 days, we on this channel will be talking about, how much of a spectacle Matt Hancock has made of himself. Some of the things that he will say will both be stupid and also potentially quite revealing. But I'm going to kind of defend him a little.
Now, you see, this is where I am. He's being scapegoated. I hold no candle for this man.
Well, not just that.
The idea that it was all Matt Hancock's fault. Everyone has decided. There is even a quote that one of the diaries that was submitted that basically Boris Johnson was keeping around, so he had a scapegoat at the COVID inquiry.
Yeah. So Dominic Cummings, Sadiq Khan, the media, social media can all now say 3 years later, he did this, she did that, it was his fault, and so on. It's all very well in hindsight, as is the saying. And, let's be honest, who would want to have been either a chief medical officer or a senior civil servant or indeed a cabinet secretary or the Prime Minister at that time, making decisions that were critical to the country's health and future financially? And a lot of people are very
forgiving of that, and I understand that. Yeah. And I'm more forgiving about decision-making in the early weeks. What I'm not forgiving of is the decision-making when they go, we didn't bother looking at the cost and benefit analysis. Well, that's how all policies should have been made.
Yeah.
And when you immediately, within a few weeks, saw the costs of your policy, you should have changed your policy.
Yeah.
They were weak. They were egomaniacs. They got a god complex.
Yes.
And we're going to talk to Laura Dodsworth later in the show, whose brilliant book about how basically we were all terrified by deliberate propaganda to terrify us at the time. They terrified the nation. They riled up the media, and then they basically said, but everyone's demanding we close schools, put people in masks and all of that. And then they said, but we did what the science said. There was no scientific backing for that. Now, what's interesting, of course, we know from what Jenny Harries, who's now charging Health Security Agency, for goodness sake. She was the Deputy Chief Medical Officer. We know from her evidence over the last couple of days that, for instance, things like there was no evidence for masks. Now, we were told that at the time. We were told that in March and April. There was not a mask mandate until later in the summer in 2020. Now, I went along with the mask mandate at first because I assumed the evidence had changed. They said there was no evidence for them.
Yeah, we didn't.
No, we didn't. No, because I'm not a scientist and neither are you.
Exactly. Yeah.
But when the chief scientists say there's no evidence for them, and then idiots are wearing them, I'm like, that's crazy. And then they suddenly said there was evidence, and you think, that's getting us out and about. I think the evidence is probably pretty flimsy, because why would it suddenly change that much? They produced no study to show this. But my view was it'll get everyone out of their homes. And if that's what we need to do to get everyone back to a vaguely normal life, get our economy going, get kids in school, then I'll live with it.
Yeah.
And then the more and more evidence came in that, of course, that it was just completely made up nonsense. And they were doing it because people thought that masks should work, so that they should work. I still see people wearing them today. And by the way, if you have your kid in them, you're a child abuser and you should have your kid taken away from you. It's as simple as that. And I will always give you a piece of my mind wherever you are when you do that.
There are still people walking along the street on their own and in cars on their own wearing masks.
Don't
it's
even.
hilarious.
People who come into this building doing it. I mean, I'm sorry, you're certified to be insane. If you're that concerned, read up on it.
Yeah.
But she said that. Now, the idea that the whole nation is not up in arms, that we were forcibly under threat of fines. And people like me, you're going to lose. I can't break the law. I'd lose my job.
Yeah.
So under threat of that, we were forced to do something utterly pointless that was bad for us socially, bad for us medically to do that. When they knew there was no evidence.
Yep.
Same for schools. Our kids were imprisoned in those masks. I will never forgive these beep, beep, beeps, because I cannot say those words on air, but oh my God, I want to, who did this to our children. I'm sorry, I think we need to have a class action. I want these people sued within an inch of their lives for doing that, because you have an excuse when you're not sure. If you know something will not save lives, but it has a harm, and they did harm our children by putting them in masks, and harmed us by putting us in masks, taking away people's faces without any good cause. And their education. It's unforgivable. And yet they're sitting there talking about, oh, well, he said and you said. I despise this inquiry.
So the whole COVID inquiry is not going to get to the bottom of, what happened, why, and importantly, if it ever were to happen again, have we learned lessons from it? Because guaranteed, I'm afraid, Julie, if this were to happen again next year,
we'll be
the same thing would happen.
This is why I do bang on
reaction
about
from
it.
Politicians. I'm afraid what happened in 2020-21 was all about self-preservation.
Yep.
It was politicians, civil servants, and those that might be in the firing line later thinking, let's overreact regardless of the consequences, because I don't want to be blamed for an excess.
I'll cover my back. That's what it was. And again, and we all suffered. Well, apparently Matt Hancock said this morning that his concerns weren't taken seriously until the very end of February 2020. He'd wanted to have a COBRA meeting, an emergency meeting, and that misinformation sometimes spread to the Prime Minister about departments in an unhealthy and toxic culture. He said his department was trying to wake Whitehall up to the threat, and basically he says, look, his department wasn't under par and it wasn't a mess. So he's basically coming out fighting, defending himself, but against sort of all comers. And the thing is, everyone is going to sort of be able to point to something saying...
So he's the good guy, is he? He's the good guy, and his good intentions were blocked.
He's the good guy who put a load of elderly patients with COVID into care homes and didn't think that might go horribly
But also,
wrong.